Namaste. I'm Dr. Shubhra Chauhan Arunmay, Senior Consultant Head and Neck Oncologist at Gleneagles Fortis Hospital at Chennai, Sholinganallur. So today we are going to talk on a very important cancer, that is oral cancer. வாயோட புற்றுநோய். Now why this is important is the first question everybody will ask, because there is a large amount of incidence. Though the incidence among the world may not be highest, it may be just around, maybe it may coming now around 15th in the line. But the point is that in India or Southeast Asia, it's one of the major cancers. Not just that, in India பொறுத்த வரைக்கும், it is very, very high. The rate of oral cancer is very high. Now, why so? So that I'll be telling you about the reasons why we get this cancer. So the importance of talking about oral cancer in India is very important for the reason that it is high in India. And second most thing is it is easily preventable. And the third important thing is it can be caught at a very early stage, meaning if we just start eye care, we can find it out. But still, we as oncologists get patients pretty late. ரொம்ப லேட்டா வருவாங்க. Why? Because they will be just delaying it or they will be ignoring the signs. So that is the key thing to talk in to what we are going to talk today. So first and foremost, coming on to the risk factors. In risk factors, of course, oral cancer is more in males and less in females. Other doesn't mean that females are totally excluded. Now, with the habit usage among both the clientele, like both the males and the females, is high. That's why we tend to get even a lot of females getting oral cancer. So the risk factors are, as all of you know, will know, is tobacco. So tobacco either in smoking form or non-smoking, that is chewing form. But lot of you, what you believe is that oral cancer, when you are chewing this areca nut, supari, the vettal pak, it will not come. That's what they think that, but that is not true. The changes, the chemical changes which happen because of that, not only cause a lot of changes in the mouth, meaning it makes the mouth tight, it doesn't allow you to eat any spicy food, it doesn't allow you to open your mouth wide. So tomorrow you want to eat a large burger or eat with hand, it is not possible. Adella happens because of this usage. That is not just tobacco but even areca nut. So chewing in any form, to be very true, is not good. Second thing, when we come to smoking, what everybody feels is that it's the regular cigarettes which cause it, not the other cigarettes. But that is also not true. Even the filter cigarette, the finest cigarettes you may be having, just because we have the finance to buy a fine cigarette doesn't mean it makes us free of a risk for getting cancer. Also, a lot of people feel is that we can do it with hookah, or you can go in for another form like lower form of cigarette is a beedi. But all the forms have the risk. So in short, what I'm trying to tell you is smoking and smokeless tobacco, including areca nut in any form, is a risk for you. So don't just think that I'm trying to go in a better form or I'm going to a lower form and I will not be at risk. So that is not the point. Now, what happens is a lot of us have this habit of smoking and taking alcohol along with it. So, when we do that, when we combine both of them, then the chance of the changes in the mouth increase the chance of the cancer. So, alcohol separately has not been highly proven, but when taken in combination, it is increasing the risk of that person to get a cancer. Now, a lot of you may argue that we are having, I'm like, we are having our relative or our elder, our party, or our grandmother not have taken tobacco for so long. They have taken tobacco, but they never had it. And why should I? So it is the not just the you habit using, but also your risk. So you cannot compare your risk to another person's risk. Another thing with time and changes with environment also keeps adding on to it. So if you see, even if you have not had, if someone in your family has not had the usage, that doesn't make you a candidate that I will never get it. So don't think you are privileged for not getting it. So you will always be at risk. So that is important to understand. Second thing which is coming up very new now is the virus of it. So HPV virus, to be very true, that has a chance of creating cancer in the mouth, more in the back side of the mouth. That is oropharynx, we call it. That means behind the tongue area, a tonsil area, pinnad. So why that is important to understand is because this cancer is very, very preventable. One small thing about HPV related cancer, that means a cancer which is related to HPV, is that it is little more less aggressive than the regular cancer. Also, sometimes, and we see these aged population, they won't have had any habit for that matter, especially people in the age of 60 to 80. Sometimes even we have treated patients with 90 years. So these patients, what happens is that they will have a small sharp tooth or a broken tooth which they would neglect it. That tends to keep irritating the either the cheek mucosa, cheek inside, or the tongue side, again and again and again over time. Then what they tend to do is, oh, it's irritating, let me just put an ointment. So they'll take an anesthetic ointment which is helping it to prevent the pain, and then again they'll keep continuing, and then it'll keep irritating. Now over a period in time, this tends to cause cancer. Now, one more point is that after this sharp teeth is there, the tobacco is there, and alcohol. These three things for sure. And now the virus which is coming up. Now, coming on to the most important thing, that is, these are things which you can avoid, of course. The most important thing is how you can come to us early. Because what we see is that not even after so much awareness by physicians, by oncologists, by the government telling not to use the habit, a lot of us have the habit in us. Now when these changes are coming, they still do not come to us in stage 1 and stage 2. We see still now not just the uneducated, even the educated patients coming at stage 3, stage 4. Why is that true? That is true because these patients are either not aware or they want to neglect the signs. So first you need to understand the early sign, point 1, and then you need to understand why is it important to come in early to us, right? So first, for the early signs is very simple, especially for oral cavity. It is very simple. Even you don't even need to go to a doctor to recognize the sign. So if there is any kind of a red or white change in your mouth, like the change can be in your lip, or it can be your cheek or the tongue or below the tongue. How you have to do it, I will let you know. But you need to know what are you have to check for. So either it can be a red patch, it can be a white patch. Now these patches, important thing to understand is it has to be chronic. Chronic means it has to be there for some time, at least 2 3 weeks, and it is not healing. It's there and it's continuously there. Then, if you have a proper ulcer because of a sharp tooth or generally any ulcer which comes in the mouth, anywhere in the mouth, that again, it is not healing. An ulcer which came today because by mistake you bit your tongue is not something to panic and run to the doctor for. But some ulcer which has come and it is not healing over again 2 to 3 weeks, you need to visit us. Third thing is that if there is any growth, not just a punched out ulcer, if there is any growth in the mouth, like a cauliflower kind of thing, that also any place in the mouth, again you should visit us. Or if there is a swelling in the neck, sometimes you may not see anything in the mouth much, but you may suddenly develop a swelling in the neck anywhere around here. In that case, you should be aware of that. Then some patients have difficulty in eating, or if there is a change in voice, these also. And last, not the least, is that, like I told you for aerated canal, it may not initially cause an ulcer, but it will cause a reduction in mouth opening. So you take your 3 fingers with vertically, don't keep them flat, open your mouth and see if you can open your mouth well, or if there is severe burning sensation in the mouth. So if your mouth is not opening well, or if there is too much burning in the mouth while you're eating regular food, masala food, or little bit spicy food, then it is something to be concerned about. So if any of these signs, like either there is a red or white lesion, if there is an ulcer, there is burning sensation or difficulty in mouth opening, if there is a growth in the mouth or there is swelling in the neck, are something to be alert of. Now, where do I check it? So if I just say you open your mouth and check, it's difficult. So what you do is go to a place where there's a mirror in front of you, where there is enough lighting which goes inside your mouth, not just on your face, and try to open your mouth first is white. Yes, it's opening well, and my fingers are going, and I don't have burning sensation. Then you start, or even if you have, how much ever you are able to open, start checking for all the sides. So very simple. This is known as like self-examination. What you have to do is you just have to hold the lip, upper lip, retract it, take it upwards, see if there is any ulcer, red, white change. Same thing you do for your lower lip. Then open your mouth wide and turn your head on one side, see on the cheek side. Turn your head on the other side, see on the opposite cheek side. Then take your tongue out nicely, see it anything on the tongue. Another important place is below the tongue. Take your tongue up, nicely up, Make sure the light is falling in the base. It's called floor of the mouth. See if there is any change, and then go upwards and see on the palate. So every side should be given equal importance, because generally what we tend, when we tell self-examination, patient will just go stand in front of the mirror and just open and see and say nothing. So that will not solve the problem. The problem will only be solved in early detection is when you recognize it and there is nothing happening in any part of all these sides. Then what you do is you just turn your neck to one side, just see if they are feeling any swelling here or any swelling here. That's it. The whole process is not going to take even 5 minutes if you do it daily. But if you just do it on a regular basis, especially if you are a habit user, will make things easy for you and for us. So why so much importance on early detection? So you say, okay, I'll get when I get and I will see later. The point is that when you come to us early, when you recognize the sign early, and when we work up, the problem will just be localized or be present in the mouth. It won't have spread to the neck, which is a great advantage. Why? Because all these cancers have then got to stay in the mouth, but they then spread to the neck, and then only they spread in the body. So a tumor which is only in the mouth without spreading the neck is a very good tumor in the sense of prognosis, we call it. That means how long the patient is going to live with cancer free, which is very high for patients who don't have spread in the neck. It is higher for patients when the tumor is smaller. So some patients will have a bigger tumor in the mouth without a neck disease. Those patients are at a little better risk. But if the tumor in the mouth is also smaller, your risk for developing a second cancer is very low. Your risk of death because of cancer is going to be low. Your risk for getting back the cancer and spreading in the body is also very low. And most important, when we treat these type of tumors, you going back to your work or your normal life is very, very fast. This is the most important thing why early detection is important from your point of view. So life is one thing. Of course, whenever we talk about cancer, we always think about life, death. So life is one thing which I'm telling is important, but not just that. Nowadays, we always look into quality of life. It's called QOL. So patients in cancer treatment now more are just looking that you treat us and we are going to sit in the house like a morose patient. No, they want to go back to society. They want to go back to their regular work. They want to go back to their regular function. If there is a teacher, she wants to talk normally. So I have patients where they have been treated completely and they have gone back to work in the third week also. But they were alert. One is their encouragement to get out of the problem faster. But second thing is they were early enough to come to us. So that is why early detection becomes very, very important. So one is the risk, which majority of us you knew, but something which I have added is HPV. Maybe some of you did not know, and arecanut, which a lot of you think that doesn't cause cancer. Second thing, as I told, is early detection. So these are also known as the warning signs, and I always believe that warning sign is something which connects the patient to us. They bring you to us earlier to treat you much earlier. And last, I would like to mention, of course, it's not something you need to be like really well read about, but something you should know is that when the cancer is in the early stage, the treatment is very small. In oral cavity, it is generally surgery if you are fit for that. And very rarely we have to add on chemotherapy or radiotherapy to it. Sometimes, if you're not fit, you have to give radiotherapy. But when you come to us at a later stage, that means at stage 3 and stage 4, 100% you will need a multimodality. That means you will need treatment from all of us, the surgeon, the radiation oncologist, the medical oncologist. So, we at Gleneagles, as a team, we are Triam Oncology team, we sit here together. But the point is that we want you to come at a stage when the treatment is smaller and one of us are able to treat you. So you can understand the importance of early stage coming and recognizing it early compared to coming in late. You need more treatment, more finances, more time, and more morbidity, we call it. So what is morbidity is that, as I told you, you have to go back to your life normally. You want to go back to your regular activity or normal activity early. So those things happen at a later time because your treatment time is increasing. Your treatment spans to 3 months plus. Whereas I told you, we have patients where we treat them in 2 months and they are completely healed. You can understand the difference in it. you, first and foremost, stop the habit. Second, learn to screen it yourself. Teach others to get screened. We also have very small like screening. If you are worried or if you are the kind, I don't know how to do that, you can always walk in for a regular screening. That is also possible. A doctor health screening is also okay if you are very worried. And we can conduct camps, or we sometimes do camps where we check this out. So that was for oral cancer today, for your early signs as well as for your warning signs, you can say, and risks. Thank you.